to them. Islam. Basic beliefs in Islam are that there is one God. They call him Allah. Their scriptures are called the Quran, and I've seen it spelt both ways. And then they believe in the Prophet Muhammad, who is the prophet that God spoke to in writing the Quran. There are 5 pillars to Islam. There's actually 2 different sects of Islam. They both have the 5 pillars. One has 3 more pillars, but both groups have these 5 pillars. One is that they have to say a profession daily, and that profession is that there's the one God who's Allah, and the Prophet Muhammad is God's prophet. They pray 5 times a day facing Mecca. So your patient may ask you, which direction is east. Their prayers usually only take a few minutes, so if you come in and you see your patient praying, it's not going to be waiting an hour. It's just a few minutes. They believe in almsgiving, which is giving to the poor as long as you're able. They believe in fasting during Ramadan, and they say that sometime during your life, one time during your life, if you're able, you should make a pilgrimage to Mecca. Now, some nursing considerations. Most Muslims, the religion is Islam, the people are called Muslim. So most of them will want halal foods. Now, this isn't just the foods, sort of like kosher. It's more than just the foods that are on their tray. Halal foods, an animal has to be slaughtered in a specific way. So it needs to be halal. It can't just be that you take any pork products off their tray. So most hospitals can make halal meals. In halal, there are no pig products, so no pork, no alcohol. And then the other things to consider is those 5 prayers a day. They also do a ritual cleaning before their prayers. So again, if your patient is asking you for towels and water, don't say, oh, the next shift is going to give you your bath. This may just be a religious ritual, so go ahead and give it to them. Many will use a prayer mat because they want the location where they're praying to be cleaned as well, so they may lay a prayer mat on the floor and kneel on that. So it doesn't mean your patient fell out of bed if they're using the prayer mat. And if they can't get out of bed, they may still want that prayer mat kind of over their lap. So it's something, if you see it in their room, don't fold it up and stick it away. It may be something they want to be able to get to easily. Depending on where they're from and how strict they are, some women may want to keep their heads covered. And they celebrate Ramadan, which is a month long, and they fast from sunrise to sunset. So they can eat before the sun comes up, and they can eat again after the sun goes down, but not in between. So those of you who are going to work night shift, that may be something to think about, to order up some food before the sun comes up for your patients. Now, they would say children and people who are ill do not have to follow the fasting of Ramadan. Again, preserving life is usually considered a priority. However, our patients rarely think they're as sick as we think they are, especially if we've really gotten their symptoms under control. So your patients may want to follow Ramadan, and the patients have the right to do that. A religious leader in the Islam faith is called an imam. Buddhism. Buddhism is probably one of the hardest religions to describe, and probably the one that has the most variation within it of what it's going to look like from one patient to another. In classical Buddhism, they have the Four Noble Truths and the Eightfold Path. The Four Noble Truths say that life is suffering, and we feel that suffering because we become attached to this world and ambitious for things in this world. And if we can separate ourselves from that attachment and ambition of this world, that's how we separate ourselves from suffering. And you follow the Eightfold Path in order to get there. Now, having said that, that's classic Buddhism. You will find many Buddhists who have really the same sort of philosophy, but wouldn't necessarily say that the Four Noble Truths and the Eightfold Path are part of their beliefs. But it's still the same religion, even though they may not talk about it in that way. So Buddhism, it's kind of a detachment. The goal is to detach yourself from both wanting things in this world, and then you don't have suffering by not attaining them. So there's kind of a detachment to it. The goal is to achieve enlightenment. Now, enlightenment to a Buddhist is not the same as heaven to a Christian. It's not a place. In fact, when you become enlightened, you lose your individual identity and become one with the cosmos, one with the force, one with kind of the spiritual reality, but you're no longer a specific individual. They believe in karma. Karma really means cause and effect or balance. They would say if you drop a pebble in a pond, the rings go out from that pebble and can go all the way across to the other side of the pond and change things on the other side. Just like a small action in your life can have reactions that stretch out way beyond the initial event that happened. And life is, the goal is to keep things in balance. They try and do good, and doing a little bit of evil can have far-reaching effects that you had no idea would happen. They believe in reincarnation, and I think to most Westerners, reincarnation sounds kind of cool and it sounds kind of good. To someone in Buddhism, reincarnation is not good. Reincarnation is like the hamster on the wheel. You go around and around and around, and you get absolutely nowhere. You die and you're born, you die and you get born, you die and you get born, and the goal is to get off that hamster wheel. And when you get off it, that's when you become enlightened. You reach enlightenment. You'll see Buddhists use chanting and meditation, and they believe strongly in honoring their ancestors. So some nursing considerations: many Buddhists will be vegetarians, not all, so we want to ask about that. Many will use non-Western treatments. Again, patients have the right to use, they have the right to make their own choices. So our job is to integrate those treatments into the Western medical treatments that they have ordered, as long as they're safe. And the other part of our job is to know, to look up any potential interactions, and then the patient gets to decide which one they would like to do if something is incompatible. Because it's got this detachment to it, they really value stoicism. They're going to try and not be affected by pain. So your patient may not look in pain. So don't just go, if you don't see any outward signs of pain, you don't ask them about pain. They may just be very stoic in how they handle pain. And again, we may run into some conflicts here, that they may view their illness as karma. There may be something that they did in the past or in a past life, or this may be a cleansing they're going through in this life to prepare them for their next life. They may not see the illness the way we do, and they may not see the necessity for treatment the way that we do. Shamanism. This is primarily the Southeast Asians in our area are the patients you'll run into who practice shamanism. The basic beliefs of this is that the shaman is the mediator between the spiritual world and the community that he serves. The shaman will use prayer, chanting, amulets, and talismans, and he'll go into a trance. When the shaman's in his trance, he can leave his physical body and enter the spiritual world. Now, for many people who follow shamanism, they want a healer. They see their illnesses as spiritual, and they want a healer who can handle the spiritual or supernatural causes to their illness. So what does this mean for nurses? Well, shamans often use herbs or salves that they put on, or they perform rituals. Now, the herbs and the salves, again, our job is to help the patient use what they would like to use, but to know if it's going to interfere with something we're giving, and then the patient, we need to inform them that the two are incompatible and they can choose which. Most of the hospitals in our areas are letting shaman into the hospital to do rituals. If there's fire, they'll ask them to find a different way, and most of the shaman have found ways to be able to do the rituals they do without using fire in the hospital, or without using some of the things that really could be a problem in a hospital. So you'll find there's pretty good coordination here. You're probably going to have to call social services in order to work out what the shaman can do, and what they can compromise on and what we can compromise on. These cultures have a very holistic view of health. It's not mechanistic. They don't see blood pressure as being the cause of plaque in the artery from the diet that you've been eating. They see it much more holistic, that there's a spiritual side to you, and if you don't, taking the medicine for the blood pressure might help, but unless you treat the spiritual cause, and unless you treat the whole body, not just the plaque in the arteries, that you've really missed the point. You've treated symptoms without treating the root cause. And sometimes people who follow shamanism, they really don't understand Western medicine. It's so different from their beliefs that sometimes there's just a real miscommunication. We don't understand their viewpoint and they don't understand ours, and that can lead to a lot of conflicts or misunderstandings that put patients at risk. Adventists, this